Hi, I'm Lindsay. I'm going to be your nurse today, nursing student. Can you tell me your name, date of birth?
I'm Brittany Lilly, March 19th, 1996.
And where are you?
I am at the hospital.
Do you know why you're here?
Yeah, my stomach hurts really bad.
Ooh, okay, we'll get to that. And what day is it?
Thursday.
Yeah, good job. And so she's alerting oriented times for, I can say all of those if you'd like, time, place.
No, you're
person. Okay. And I say she's well dressed, well groomed, and well nourished. And can I have her current vital signs? Sorry, can I have her temperature?
Yes, 98.9.
Okay, so tiny bit elevated, 98.6, but she's good. Can I have heart rate?
106.
Slight tachycardic, but 60 to 100. Blood pressure?
118/89.
That's fantastic. We want 120/80, and then respiratory?
20.
Fine, 10-20, and then how old is she? Just for funsies. 26 then today. And then O2?
99 on room air.
Okay, that's great. 95 to 100 is what we want, according to Jarvis textbook. And then, so I'll be doing a skin assessment kind of throughout as well. I hate blinking. Blinking is fine. I'll take care. So, I will just go ahead. So she's appropriate color for race and ethnicity. Her skin temperature is nice and warm, texture smooth, not excessive moist or dry. Turgor is good, no tenting. Can I go ahead and I'm gonna do peripheral test. So her nails look good, capillary refill is under 3 seconds. I'd also do that for lower extremities as well. And then her nails look good, no clubbing, no yellow, no ingrown. And can you do this though, just so I can make sure there's no clubbing? Yeah, good. And then I also checked bilaterally on her legs as well. Hair distribution on extremities is good. Again, color is good, temperature is good, no edema, right? Because you came in for abdominal pain. And that's bilaterally for all her extremities as well. Yeah. And then I also, wait, I went out of order. It's okay though. I'm gonna say, oh yes, she has IV, right? And can I see it? Which one is it in? So right AC.
And
is
her
that
right AC. Yep.
Okay, so I see that it is, so you can look a little bit too. Looks like 22 gauge perhaps. 20 or 22. I think it's blue. And then I do see that it is dressed appropriately. However, I think I see some redness there. Might feel a little bit warm. Yeah, that's what I thought. So I am going to flush it a little bit and then you tell me if it hurts. Okay, so I can't exactly say that it's intact or patent. We might want to consider moving it. We would do it above or probably switch to the other arm as well. Does she have any lines, drains, tubes?
No.
Fantastic. If she did, I would look for color, edema, odor, wound. You said no wounds either? Okay, so I would look for wound edge approximation, any edema, color, temperature. Yeah, but she doesn't, so yay. Okay, so for also I'm gonna do cardiac. And I know I have more for peripheral, by the way.
You're fine.
So I'm going to listen to the aortic, pulmonic, can you turn a little bit for her? Herbs, point, tricuspid, mitral. I'm also going to palpate the apical pulse. And based on the vital signs as well, read, she is normal sinus rate and rhythm. Apical pulse is good. I don't hear any arrhythmias, no muffling, no murmuring. And I'm gonna go ahead and get her pulses as well. And I would do this bilaterally, so radial, carotid, brachial, and popliteal, and posterior tibialis, and then dorsalis pedis. Her head is normal cephalic size and shape. Any pain?
No.
I don't see any scars, lesions. I don't see on her skin either while I've been doing the assessment. I don't see any scars, lesions. Her head doesn't have any vermin or scales that I can see. The hair distribution is good. It's well lubricated. Her eyes, ears, and nose are all symmetrical to her face and proportionate as well. Can you look past my shoulder? Yeah,
Sorry.
look this one. Good, and now look this one. That's a bright light, right? Yeah. That's why I was like blinking for a bit. So both her pupils are equal, round, reactive to light, and accommodating. And can you do this for me? Mucous membranes are pink and moist, glare is good and clear. Her ears looking in.
They're probably really gross.
Upon assessment, her tympanic membrane is intact, auditory canal is good. Can you repeat back to me?
Gorillas are fun.
Yeah.
I like soup.
Okay, hearing is intact, and are you feeling? I'm so going out of order.
You're fine.
Can you plug a nose, breathe in, plug a nose, plug in air, plug the other, breathe in. Perfect. Oh. Mostly okay. And then I have an orange peel, so tell me what you smell.
Orange peel.
I would do that bilaterally, so patency is intact for smell, or nose is patent intact. Okay, anyway. And then, oh yes, are you feeling any numbness, tingling? Okay, and can you tell me if this, can you close your eyes? Can you tell me if this is dull or sharp?
Dull.
Fantastic,
Yay.
sensory is intact. So I already talked about her pallor pulses. Let's talk about your pain. Can you tell me
Okay.
what pain you're feeling?
Yeah, it hurts really bad in my stomach. It's like a really sharp pain.
A really sharp pain. Okay, so when did this happen? When did it start happening?
Yesterday.
Yesterday.
Okay, so precipitation was yesterday, PQ. Quality, you're describing the characteristic.
Yeah,
You said it's
sharp.
a sharp pain. Okay, and then is it like spreading, radiating throughout your body at all? Is it radiating?
No, just in the right lower quadrant.
Yeah, it's just like right here.
Okay. And then severity, you said 0 to 10, 0, no pain.
11.
Okay, we're getting bad. I would do something about that. And then, does anything make it feel better at all?
Just
The
like
morphine.
morphine.
The morphine, exactly.
Yeah.
And then, did it get better at all? Were you able to sleep okay?
No, I can't sleep at all. I need my
Okay.
morphine.
Okay, and since it just started yesterday, it was acute, and I might question this part a little bit at this point if they were constantly asking me for drugs. Okay, so I'm gonna go ahead and do a respiratory assessment, and then I'm gonna check. I want to keep that for a little bit later since it's hurting. I don't want to upset it too much. So I'm gonna go ahead and listen bilaterally. So on the front, one. I want you to take a deep breath in and out. So you'll hyperventilate. Stop it. 2, 3, 4. I'm sorry.
That's okay.
5.
I'm like trying to turn so
and
you can see.
5. And then posterior as well. So 1, 2, 2, 3, 4, 5, 6, 7, 8, 9, and 9. And based on vitals, they are good. So I don't hear any adventitious sounds, breath sounds, all the lobes sound, all 5 lobes sound nice, clear. Wow, it's messing me up. It's fine. And I'm also I'm saving your abdomen for last. So, can you go ahead and circumduct your head like this, and then elevate your shoulders and depress your shoulders. Can you squeeze? I think I did this. 5+ for grip strength equal bilaterally. Can you abduct your arms, adduct your arms, circumduct your wrists? Can you abduct your legs? I would do this bilaterally. Adduct your legs, thank you so much. You would probably not be able to do that if you're in that much pain. And then can you circumduct your ankles for me? Perfect. Okay, so range of motion is good. I don't feel any crepitus or rigidity, and I did active range of motion for her. Her chest expansion, this is so awkward. Her chest expansion is nice and equal. I don't see any use of intercostal or accessory muscles. I don't see retraction of intercostal muscles. I don't see any nasal flaring, either facial distress. I think is from the pain. I did make sure her respiratory rate was good because she's on morphine, and that could be depressed, and it was still good. And all right, so I'm gonna have you lay down for me if you're able to, and I'm gonna go ahead and so I see that her stomach is bulging. Can I make that up?
Sure.
So I think I might maybe see a hernia potentially in the right lower quadrant. I don't know, would that happen? Potentially, I guess. And I don't see any striae, ecchymosis, scarring, but peristalsis, I do see that. I'm gonna listen as well. So I'm gonna start in the right lower quadrant, and I'm gonna really listen. Can you tell me, do I hear bowel sounds?
They're hyperactive.
Hyperactive? Okay, in all 4 quadrants?
Yes.
Okay, so hyperactive means that there's more than 30 bowel sounds in a minute. I am going to palpate a little bit, okay?
Ow.
Okay, that hurts, like, does the pain get worse when I touch it?
Yes.
Okay, so I won't do
really
deep
bad.
palpation there. What about in this up here?
That still hurts a little bit.
What about over here?
It's not as bad.
Over here?
Not as bad.
Okay, so I'm definitely gonna make sure I document those findings to the doctor. And let me think through in my brain real quick to make sure I didn't miss something major. Just chill there for a moment, please. Just relax. You're all good. Nose, mouth. Oh, mouth. I didn't do your mouth. Can you open your mouth for me? Yeah, okay, so I see that the tongue is midline, also her trachea is midline, and her mouth, her dentition is good, intact. I don't see any exudate, and gingiva are pink and moist. Head, skin. What is the last bowel movement?
Yesterday.
Yesterday.
Okay, any constipation, diarrhea?
Diarrhea.
Diarrhea.
Okay. So
It's horrible.
hurt.
Help me.
Okay. And are you having any incontinence? Are you able to hold it, or are you struggling?
I can hold it.
I can hold it.
Okay, that's nice at least.
At least I say. Until you have to clean me up.
And then when did you last go to the bathroom? Urinate.
30 minutes ago.
30 minutes ago.
Any pain?
No.
Blood?
No.
No dysuria, no hematuria. And frequency or urgency with that? Incontinence?
No.
Okay. And last urine output, roughly? Normal, not excessive urine
yes.
output?
Normal.
Okay.
35 milliliters per hour.
Thank you.
Almost I'm a
I'm
child.
so impressed that you know that. Oh gosh, I'm nervous. I think that concludes my assessment.
Okay.
Oh my gosh.